be more like how do we, when governments are talking also about the system changes that we need to make, they are very often looking at it as taking something away from people, and that's why they are also not getting the support sometimes from the citizens. So, for example, when we talk about taxes and like increasing taxes, it's a burden on the system or on the people. It becomes very individual issue, and it's the other way around. So my question would be for all of you, like how do we make these choices, also lifestyle choices, but also choices for governments, question of winning or of a gain. And then also it would be interesting for me to hear also from Beatrice, like how to talk about the life that we need to lead to avoid non-communicable diseases as not something that we are taking away from us, or the tobacco and sugar and alcohol, but it's something that, how to talk about it to make it actually positive.
So I think that, at least for me, mine is very physical in the sense that I stopped everything that I was doing in a week. Like I went on spring break and I didn't return to school for a year and a half, and I don't do any of the things that I used to do that were fun to me. So I kind of had a state of mind for a long period of time where I was distant from everyone that I had relationships before, and I was in my house all the time, basically bedridden, and it's very hard to stay positive when everything hurts and nothing you enjoy you're allowed to do or are physically able to do. But then you can't succeed if in that state of mind. You have to be positive to get up and find new things that make you happy, and find new ways to enjoy how you're living, and to build new relationships, because no one wants to be around someone who's mean and sad, and I mean, no one's gonna help me if I'm mean and yelling at them. So you have to, I kind of had to learn how to be positive, because that was the only way I was going to get back up from when I fell or became sick, if that makes sense.
You want to take?
So I think your question gets me to think about leadership, because behavioral change is really, really difficult. And it's not just coming from by itself. And one issue I'm considering in my company is smoking. So you're not allowed to smoke, in the building. Yet employees can leave the premise and then smoke. Is that okay? Maybe it is. But you could also say, if you are at work, you should not smoke. You should not even leave the building to smoke. So what is the role I should take as a CEO? Should I simply say, okay, we're actually not going to support that when you are at work, on campus, traveling, whatever, that you are smoking. So maybe, I should actually take the role as leader of a company, politicians as leader of nations, and help people. So I believe, a few years from now, it'll be inconceivable that people are actually smoking while at work, even though they leave the building. And if you take a stance on that and support those who need to, quit smoking, or at least get out of smoking in the work hours, I think a company should take that responsibility. So it's about leadership, and I think in a political setting, it's difficult to do these things, because there's also an election coming up. But I think we need to show more leadership in actually getting, population health to a better place.
Can I just add something to your point, and then also a bit back to the previous point? I think the change from the system or from the health system, I think the change would happen if you look at the person rather than the diseases. And already that to me, and we are not doing that enough. And in the same way, then you would analyze what is it that will bring health, broadly speaking, as we are saying, to that one person. And then it would help everyone to rally around the key intervention, but also looking at what are the ways to avoid what you rightly well describe as the economic drivers. We talk about socioeconomic drivers, which we know exist in health. There are also economic drivers. I think for me it was very shocking, for example, to see some photos and an article that came about last year on some of the poorest indigenous communities in Mexico that are by themselves under-resourced, with less access to services, highest child and maternal mortality rates. And the photo that spoke by itself was with this young pregnant woman, probably a teen woman, with a fizzy drinks, not to talk about any particular. And the article was talking about how these communities have become totally addicted and had more access to fizzy drinks than to water. So it's exactly the point you're raising. I think, and this is one part. The second part on the behavior change, I think I do agree with you. Sometimes people have no choice, but I think one key element that we can work on together is the issue of information and proper information. And information that talk to you, meaning that you can understand without hiding it behind big difficult medical terms or behind commercial words that we bring you. And I think if we manage to do that, which is not simple, but I think if we manage to do that, then people will be informed and be able to make their own decisions and also to claim their rights. And that's the other part of it. It shouldn't be anywhere for anyone that you can't access safe water for free or for cheaper than fizzy drinks, right? So you raise a very important point. Thanks.
Great. Next question.
Hi, my name's... Can you hear me? My name's Luke Allen. I'm a family doctor from Oxford. I work on NCDs in primary care, which is family medicine. My question's about the political declaration, which is kind of coming out on Thursday. There's a lot of really good content in there. It talks about life course approaches and lots of common factors which affect older and younger people. But the focus is unequivocally on preventing NCD deaths prematurely in people between 30 and 69, which cuts out youth. There's a bit of a tension as advocates for youth NCDs between doubling down and fully supporting the agenda addressed there versus stressing more the unique set of factors which drive NCDs in young people. I think ultimately it's both and. We've got to push for what's written in the declaration while stressing that there are other elements that are required to control NCDs in young people. But how do we go about doing that most appropriately and most powerfully? There's not very many of us in this room. We want to be as effective as we can. What would your advice be?
This is more of my personal reflection to what you have said, rather than the institution answer, which I don't think exists. I think we're all looking at what will come out of the declaration. One point that we have been observing since when we started looking into the issue of NCDs is the fact that data themselves often start after childhood. So we were discussing with colleagues at WHO that are producing the scorecards, I think, for countries on how they're doing vis-a-vis the best buys. And a lot of this, when you look at how they're measured, relate to adulthood. And that's maybe a starting point. Whether you will go in the political declaration or not, I think we do need to make sure that we start building a body of evidence on on what exists and how children and adolescents are affected, and also more so, and this is something that we are trying to do, how to make the argument, which is the economic argument, not just the rights argument that we have, that prevention needs to start earlier. I think that would be my immediate response to you. And a lot of us have been saying that. So already I think it's good that we find a balance in the declaration, if we do, between prevention and care, because that was the other discussion that was happening, and both are equally important, and we know.